George.
We number now. What's it for women? Yes. Today, 12 minutes. Man, you know the number.
Hello, good afternoon, Helena and Dr. Uswajiman. You're welcome to GME, virtual GME platform. We would like to wait for some of our colleagues to join so we can have the meeting, please. So kindly bear with us and give us a few minutes as our colleagues join. Thank you.
All right, thank you, that's fine.
Thank you once again. Hello, everyone. Good afternoon. Good afternoon, and thanks for your patience. Thanks for joining on this call. It's been a good afternoon, and we hope to learn more as we've joined in for a very important discussion. To start, we will share a word of prayer, and we would kindly ask Ms. Georgette Mensah to share a word of prayer with us. Georgette, over to you.
Let's pray. Thank you, Lord, for today. Thank you for life. Thank you for allowing us to see a new day. We ask that as we're about to have this meeting, it will go well, we will understand what we need to, and at the end of the day, we'll be able to, at the end of the day, we'll be able to do what we have to, and we thank you for everything.
Amen. Hello, Georgette. Hello, Georgette. Thank you for that prayer. Thank you very much. Good afternoon once again, and thank you for joining this talk. We have on the call various ladies from GME, and you're all welcome. We also have from the other side, we have Madam Helena, Mami Amafrem Pong from M Pharma, and she is a consultant on the 10,000 Women Project. And Abigail, kindly mute your microphone, please. When you join the call, you kindly mute your microphone so that there isn't any feedback. Like I said, we have on this call Madam Helena Mamia Mafrempong, who is a consultant at M Pharma on the 10,000 project. We also have Madam Sufaya Ba, who is the Chief Operating Officer of M Pharma. She will join us as we go along. And this afternoon to speak to us on cervical cancer, all that we need to know on cervical cancer, we have Dr. Ya Owusu Ajiman, and she is the Health Services Manager, and she's been in this position for about 5 years, and she has clinical practice like we know. She also has various specialties, and that includes emergency medicine and pediatrics. She holds a Bachelor of Medicine and Bachelor of Surgery and an MSc in Clinical Leadership and Management from the University of Ghana Medical School. She has played various leading roles in the creation and implementation of health programs and initiatives spanning from various diseases and conditions, including malaria, diabetes, hepatitis B, and the topic that we are having today, cervical cancer. So when it comes to the topic, she's well vested and she is our facilitator for this afternoon. Ladies, help me welcome Dr. Owusu Achiman. You're most welcome, Doctor, and you have the floor. Thank you.
Thank you, Vida. Good afternoon to everyone, and thanks for joining us. I would share my screen, and then we'll get started.
Hello, Doctor.
Hi, yes, can you hear me, please?
Yes, I can. Sorry to cut you, but let me put this across. Please, we'll give the floor for us to ask questions after she's done. So please kindly hold on to all the questions that you may have so we can proceed with the presentation. If you have any question, you can send it to me, or you can also unmute your microphone after the floor is open for questions. Okay, thank you all for your cooperation. Doctor, please, you can go ahead. Thank you.
All right, thank you very much, Vida. So like Vida said, this afternoon we'll be talking about cervical cancer, and then also about why we decided to embark on our 10,000 Women Initiative in Pharma. Okay, so before the pandemic, I'm sure most people would have no clue when they say PCR. Nobody knows what PCR is. But since COVID came, every single person knows what PCR is. Everybody can talk about molecular diagnostics because of COVID. And before COVID, it wasn't like there was no need for molecular diagnostics or other kinds of PCR tests. There was, but it was just a matter of being in this continent and not having access, both financial and otherwise, to these kind of tests. But when it comes to diseases like cervical cancer, HIV, hepatitis, we did need those kind of diagnostics, but because of finances, we were not able to access these. And this had a lot of repercussions on the health of the vast majority of Africans across the continent. Now, when we talk about cervical cancer, our statistics tell us that it's the second most frequent cancer among women in Ghana. And the age group is between 15 and 44 years. And I'm sure the majority of us on this call, almost everyone on this call, falls between this age group. I know seeing 15 is a bit of a scare, but it's actually very true. And we're seeing over 2,000 women being diagnosed and more than half of that number dying every year in Ghana from that disease. In West Africa, we're seeing that about 4.3% of our population has the virus that puts us at risk of getting cervical cancer. So I will talk about that as we go ahead. This is just to let us know how close cervical cancer is to each and every one of us as a woman. All right, so we're just going to talk about what it is, who is at risk of it, and how we can all reduce our risk of getting cervical cancer. Now, I'm not sure if anyone of us has seen this kind of image before, but as a woman, this is what your cervix is, sorry. I'm sure when we talk about the female reproductive system, we all know terms like where your vagina is, your uterus, your ovaries, your tubes, and things like that. Now, your cervix is said to be the mouth of your womb. It is, if any of you have had a baby vaginally before, you know that the doctors talk about cervical, or you are 10 centimeters dilated, or you are 2 centimeters dilated. That dilation actually occurs at your cervix for it to open up to allow your baby to pass, out, and for you to have your baby vaginally if you did deliver vaginally. So this is just to show you what your cervix looks like normally. It's like a donut-shaped organ with a little slit in it. It has a uniform color. You can't see any weird, growths on it. It may look weird to you, but this is the normal cervix, what it looks like. So usually when you go to the hospital and you go for an examination and the doctors have to, examine you, and they pass that cold metal thing onto you and they open it up. This is what we are trying to see. You want to see what the mouth or the opening into your womb or your uterus looks like. So this is a normal cervix, and this is where it's located in your body. So what it does is to keep bacteria out of your womb. So like I said, when you're going to have a baby, it would open up for a baby to come out. But if you're not in that situation, it's closed, to ensure that bacteria doesn't get into your womb. Also, it produces a discharge that cleans out your vagina, which is why we are always saying that your vagina is a self-cleansing organ and you shouldn't be pushing things in there to, you know, try and clean it and make it smell like flowers or vanilla or something like that. And if you're pregnant, it changes position to protect your pregnancy. But that's a conversation for a whole other day. All right. So when we talk about cancers in general, our body is made up of millions of cells. So if you're looking at your skin or your hair or your heart, there are millions of cells that come together to make up your skin or your nails or your heart or your brain, things like that. Now, these cells contain what we call DNA. I'm sure everybody has heard of DNA, especially when it comes to DNA testing to determine when if someone is the father of a baby or something. So your DNA, it contains, you know, your makeup. If I want to know, oh, this is Vida, I can do a test, look at Vida's DNA, know that, oh, this is really Vida. This is not Beverly, or it's not Helena, or it's not Sophia or somebody else. And your DNA has instructions to tell your cells what to do. So if something happens and your cells undergo a change, what we call a mutation, it means that they're going to start behaving abnormally. They're not going to follow the normal instructions that your would tell your cells to do. So any change in your cells means that they are not able to take on the instructions that the DNA is giving them. And that's what we call a cancer. So if this occurs in the cells that make up the cervix, then we say cervical cancer. Okay. I'll just go ahead. All right. So we talk about risk factors for cervical cancer. I don't know if you've heard of human papillomaviruses. So when we talk about HPV, that's the short form I'll be using going forward. These are sexually transmitted viruses. There are a dozen types of human papillomaviruses. There are like so many subtypes. Now, when we say a virus is sexually transmitted, it means that any form of sexual contact can pass the virus on from one person to another. So if person A and person B have any form of sexual contact, whether it's orally or vaginally or whatever type of sexual contact it is, they can pass on certain types of human papillomaviruses or HPV from A to B or from B to A, regardless of gender or whatever it is. Now, there are certain types of HPVs that put you more at risk of cervical cancer. Like I said, there are millions of types. But when we're talking about cervical cancer, we're looking at certain subtypes. So when people come and they want to know whether they have that from HPV, we usually try and check, okay, what subtype of HPV do you have to be able to assess your risk? Now, when we say multiple sexual partners, we say this because now if person A and person B have sexual contact, and then person A is also having, you know, some sexual relationship with C and D and E. Now, this person is exchanging a lot of various types of HPV viruses with each of these persons. And imagine if he or she goes one from B to C to D to E to F, comes back again, B, you just keep, you know, sharing more and more HPV virus among you. So that's why we say multiple sexual partners puts you more at risk of getting cervical cancer, because you are increasing your risk for taking on different types of HPV viruses from the various partners, regardless of gender, that you may have engaged in any form of sexual contact with. Then we talk about early sexual activity. When we say early sexual activity, we usually peg it at anything before the age of 16. This is not a law thing. This is a more medical definition. Anything before the age of 16. Now, this has to do with the fact that the earlier you have your first sexual encounter, it means that you're going to have a lot of more years. So if you compare someone who had first sexual encounter at 30, that's when they start being exposed to HPV virus through sexual contact. To someone who starts at 16 and at age 30 is still, they've had 14 years of contact. So they've, you know, been exposed to a wide range of subtypes of the human papilloma viruses. Okay. Now, having other sexually transmitted infections like HIV or gonorrhea or syphilis also puts you at risk of getting cervical cancer, because they reduce your immunity. and they reduce your body fighting against these viruses. Now, just to say that HPV virus, if you get it, your body can't fight against it. But if you have other risk factors, then you are reducing your body's ability to fight against it. So like I mentioned earlier, a weakened immune system, whether it's through cancer or HIV or any other thing that causes your body's immune system to be weakened, will put you more at risk because your body can't naturally fight against the virus. Now, when it comes to cancers, we would always and forever put smoking there because smoking has a link to almost every cancer that is known to man currently. This is because smoking does a lot of things. Smoking can actually induce, earlier on I mentioned mutations, changes in the cells that make up your body, such that the DNA in your cells is not able to give the instructions like it should, and the cells are reacting in a different way than they should be. So if the DNA is saying, cell, go and do this, that information is not being passed on because that mutation or that change has occurred. And smoking is known to do that. So if you don't smoke at all, don't start. And if you smoke, you should stop. Unlike alcohol, where when we talk about alcohol and diseases, we can give room and say, if you drink A, B, C, D amounts, reduce to this or that. When it comes to smoking, it's a no, complete no, 100%. And then we talk about lack of access to routine screening. So like most illnesses, the earlier it is picked up, the better. So let's say, for example, someone has a high blood pressure. It is better they are picked up early and they're put on medication before it leads to things like, common example of a complication of high blood pressure is a stroke. I'm sure most of us know people who've had high blood pressure and have had a stroke. If they are picked up early, they're able to.
The stress of many things, and the most important things not happen.
Hello, Jemima.
Okay, thank you. So the earlier, so the same with
yes, I'm here.
Sorry, I wanted you to mute your microphone.
Okay, sure.
So the same thing with cancers and cervical cancer. The earlier we pick it up, the better. So for example, for cancers, usually we know that cancers can spread from one part of your body and go to any other part of your body. So imagine if the cancer starts in the cervix, it's easier for us to target any form of management or treatments there. But if time is passing and you're not getting any screening, nobody's picking it up, it's getting worse day in, day out. And then it's leading to things that we cannot even manage, or even unfortunately death in a number of cases because there was no access to routine screening. Right. So like I said, for HPV is sexually transmitted, and the peak time for infection for both males and females is shortly after becoming sexually active. So I said that if you start sexual activity at an earlier age, about 16 or 17 or 18, shortly after you would start acquiring all these HPV viruses. And the longer time you have to be exposed to more sexual activity or even more partners, it means that you're being exposed for a longer time and you are more at risk if you're female of getting cervical cancer. So what is the link between cervical cancer and HPV infection? So research tells us that when we're looking for the number one risk factor for cervical cancer, it is persistent HPV infection. So I said earlier that if you are healthy and you have HPV infection, sometimes your body is able to fight it off. But if the infection persists in you, we are not able to tell who the infection persists in, but if somebody's like, you have a poor immunity, or you have other STIs, or you're smoking, or you generally have an unhealthy lifestyle, you are more at risk of having persistent HPV infection, which is the number one risk factor for getting cervical cancer in any woman at all. So we're saying that nearly all cases of cervical cancer are attributable to HPV infection. And I said earlier on that we have a lot of types of HPV, a lot of human papilloma viruses. We have so many. But when we talk about cervical cancer, more than half of them are due to type 16 and type 18. This is not to say that once you have 16 or 18, you're going to get cervical cancer. No, it just means that you have a subtype of HPV that has a higher risk of pushing you into cervical cancer. Yes, the other things come into play. You have a family history of cervical cancer or other cancers in your family. Are you smoking? Have you had any routine screenings lately? Do you have any illnesses that are reducing your immunity? All these things come into play when we're looking at who is more likely to eventually progress, whether faster or slower, from HPV infection to getting cervical cancer. All right. So let's look at symptoms of cervical cancer. Like I always say, this doesn't mean that if you have any of these, you have cervical cancer. No. When it comes to the female reproductive system, a lot of these symptoms can, we can have 1,001 different diseases that would, have similar symptoms. But for cervical cancer, the number one warning sign is to have when you have abnormal vaginal bleeding or abnormal uterine bleeding. Now, this is what we describe as abnormal vaginal bleeding. Any bleeding that is outside of your normal menstrual period. So let's say, for example, today is the 28th of June. Let's say you started having your normal menstrual period from yesterday, which was the 27th. Let's say typically you have your normal period for 3 days. So you're expecting that by 29th, you'll be winding down. By 30th, you'll be seeing maybe a little dots here and there, but by 1st July, you don't expect to see, actual bleeding like that. And then let's say, so that means that, and then your next cycle or your next time to have your menses would probably be 27th, 28th of July. That's if that's menstrual period, and that should be reported as soon as possible. It's a warning sign, a red flag, so that needs to be reported as soon as possible. I'm sorry, can you hear me? I think I'm having internet problems.
Yes, there was a little break, but I can hear you now. I'm sure my other colleagues can also do.
Okay, sure. So I was talking about bleeding outside of your normal menstrual period, which should be reported as soon as possible. Then we talk about bleeding after sexual intercourse. I know there's a, I don't know what to call it, like something that everybody knows that if you're a virgin and you have your first sexual intercourse, you may or may not see blood. I mean, that's in the Bible as well. The occurrence of that. Yes, sometimes that occurs, but it's not normal to be seeing bleeding after sexual intercourse. So if you're seeing that after sexual intercourse, you need to report that as soon as possible. It doesn't mean it's cervical cancer. It could be a tear or something, but you need to report it. And then if you're bleeding after menopause, so if a female has entered into the stage of menopause, we're not expecting her to be seeing bleeding as such. Yes, I mean, if you turned 60 or 55 or whatever age it is that you get menopause in, sometimes they get what we call flash bleeding. So if, let's say, I turned 55 today and I'm now in menopause, like this is my first year of menopause, maybe once after some obscure months, 3 or 4 months, I may see some blood. Yes, okay, that's there, but you will not be sure on your own until you speak to a medical professional that, okay, I've had menopause, why am I seeing this blood? So you need to report that as soon as possible as well. Any form of vaginal discomfort, whether it is you feel like there's a mass coming down your vagina kind of, or you're feeling like there's something that is, growing from something, or you're feeling some pressure, should be reported because it's a symptom. If you're having vaginal discharge that does not have a usual smell. So like I said earlier that your cervix produces vaginal discharge, which is normal. And everybody has a normal smell of the vaginal discharge. The vagina does not smell like flowers or vanilla or chocolate. It smells like that normal fluid. It's not offensive. It just has a smell that is not offensive. It's just a normal smell. But if the smell should change, you should be able to detect that this smell is different from what you usually have, which is why we always discourage females from douching, which is when you're trying to insert things to change the smell of your vagina to smell like flowers and vanilla and things like that. No, because if the smell should change and it's supposed to be a warning sign, you might miss it because you keep using these products to change the smell of your vagina. And then any pain while urinating. I know that most people would complain of this and then they'll be diagnosed of a UTI. That's fine, this is a sign of a UTI, but any pain while urinating should absolutely be reported because it's also a sign or a symptom of cervical cancer. All right. So how do you reduce your risk of getting cervical cancer? So there are general recommendations given by the WHO. So you would notice that anyone between the age of 21 to 29 years, usually they say screening age starts from 21. Now note that these are general recommendations that WHO would provide for, global use, so a general population. Can somebody get screening before age 21? Yes, they can. They can. You can't get screening before age 21. It all depends on your risk factors. If you've had some form of risky sexual history or a family history, it all depends on what your doctor is seeing or what information you give your doctor. But generally, we say between the ages of 20, after 21, after 29 years, we recommend that you get a pap smear every 3 years. Now this, I want to explain the difference between a pap smear and an HPV test. So what an HPV test does is to pick up the presence of the human papillomavirus itself. Do you have the virus or not? And if you have the virus, what subtype of the virus do you have? And what does it mean for your, your risk of getting cervical cancer? Just like how a COVID test would let us know, oh, you actually have COVID. An HPV test will let us know, oh, you have HPV. It doesn't tell us you have cervical cancer, no. It tells us that you have the virus. It tells us the type of virus you have, and then we can counsel you based on what that shows about your risk of getting cervical cancer. Now, people between the ages of 21 and 29 are encouraged to get a pap smear test every 3 years. What a pap smear test does is that I showed you a picture of your cervix. Let me just go back quickly. This is your cervix. What it will do is we would insert something like a brush-like substance to pick up some of the cells off your cervix. So like I mentioned earlier, your body is made up of millions of cells. So what we want to do in a pap smear test is to pick up some of these cells from your cervix. We would take it into the lab, we would look at it under the microscope, and we want to see whether those mutations that we mentioned earlier, remember we said that for somebody to get cancer, there needs to be changes in the cell, mutations. Now these changes you will not see with your naked eye, you only see under a microscope. So what a pap smear test would do would be to take some of these cells from your cervix, look at it under a microscope. Are there any changes that have occurred in the cell? And that will let us know whether you have a cancerous lesion or a precancerous lesion. So do you have cervical cancer, or do you have a change that could lead to cervical cancer? So these are two different tests. So people before the age of 30, we recommend they get a pap smear test done every 3 years. Without fail, every 3 years, you should get a pap smear test done. Now, if you're between the ages of 30 and up to 65 years, we want to do the two tests together. So you get a pap smear test and an HPV. Now, you'll be wondering, why would we do co-testing? So this is it. If you get a pap smear test done, and I take the cells, I look under the microscope, I look, and I don't see any change that's occurring in the cell, it doesn't mean that you don't have a risk for getting cervical cancer, which is what my HPV test will tell me. So I may look at your cells that I've taken during your pap smear test. I may look, no change, and tell you, oh, you're fine. But what happens within those 5 years when I don't see you, if you're between this age group of 30 to 65? That's where my HPV test comes in. So if I did an HPV test for Amma, and I tell Amma that, oh, Amma, your HPV test was positive. You have subtypes, whatever it is, that puts you at risk of getting cervical cancer. And then we do a pap smear test for Amma, and the pap smear test telling us that, oh, there's no change in her cells. Amma needs to know that she still has a risk for getting cervical cancer because her HPV test was positive. So that's why between this age group, we want them to do the 2 tests every 5 years. Or if you're in a resource poor setting, you can do the pap smear test alone for 3 years, every 3 years, sorry. But we're trying to push the agenda of females between this age group to get both tests, because we're able to pick up those who are higher risk and follow them up more often than the 3 years, because anything can happen in the 3 years when I'm not seeing you as a medical professional. Now, people that are above 65 years, usually we discontinue screening if they've had normal 3 normal pap smears that have been fine, or 3 normal HPV tests that have been fine in the last 10 years or so of their life. So usually when you're more than 65 years, there's no routine screening until you have symptoms. But it means that if you're more than 65 years, you should have had, routine HPV and pap smear tests before you turn 65 for us to say, okay, we won't do any screening. But if you haven't done that and you're 65, then we would go ahead and do a pap smear test for you and an HPV test just to be sure you're okay. And then your doctor would then arrange your screening schedule to suit you because you're more than 65 years of age. All right. So let's look at this slide that's telling us about missed opportunities for cervical cancer screening. So this is 2012, but this still is relevant today. So if we take 8 million women who were not screened in 5 years, 7 out of them who were not screened had a regular doctor and health insurance, and which is true of us today. A number of women, especially those working in the corporate world, you have access to health insurance, but you haven't done a pap smear ever in your life before, which is definitely covered under your health insurance. You've never found out about HPV testing. There's nothing. You're just going about life. It's because we are not aware of this, and that's why opportunities like this are good for us to educate women about what you need to do to protect yourself. And then the bottom is telling us how HPV infection could lead to cervical cancer. And it says it could take years. Yes, it could take years from the time you first get your, you start getting HPV infection until you get cervical cancer. But it all depends on how were you picked up? Was your doctor following you up? What was being done for you? Because like it says, you can get HPV infection. And it says most infections do not turn into precancers. That's very true. Most of them don't. But if the infection is, persistent, like I said, it's not being picked up, the woman is not being counseled, no pap smears is done, we can easily go from having the HPV infection and going into cervical cancer. No matter how many years it can take, it can still get to cervical cancer. All right. So after everything, how do we reduce our risk of getting cervical cancer? So like we've said, regular screening. As a female, even if you're not doing annual checkups, it's not a part of you, make sure that your pap smear, your HPV test is is something that you put at the top. Yes, every October you would remember to check your breasts, which is because we said, we've mentioned breast cancer over and over again for years. So when it's October, it's automatic for every woman, no matter what it is, no matter where they are, everybody wants to get their breast checked. And we want to get to that same level with cervical cancer. We want it to be a part of us. Okay, I'm this age, I need to get my pap smear done every 3 years. I'm 30 to 65. Okay, I need to make sure that I get my pap smear done, my HPV test done. Am I fine? You don't want to get to the stage where you're using all your money and your time to fight cervical cancer, because it's extremely deadly. It's an extremely painful disease to have. Then we talk about HPV vaccination. So just like similar to COVID, we all got vaccinated, it protected us and all that. There's an HPV vaccine. But like I said in the beginning, financial access is a problem on this continent. The vaccine is readily available in certain centers. You get vaccinated. But what we want people to do to prevent HPV infection, especially, is to get your children vaccinated, both male and female. WHO recommends that from the age of 9, you can start vaccinating males and females against HPV virus. Now, remember in the beginning, I said no matter your gender, we can share HPV infection amongst ourselves. In females, it can cause cervical cancer. In both males and females, we can get throat cancer and other forms of cancer. So it's not that HPV infection only affects females, no. It's because of the cervical cancer aspect and how rampant cervical cancer is becoming, how much mortality we're seeing, which is why when it comes to females, we hammer HPV infection and cervical cancer together. And you need to practice safe sex. Now, it is known that skin-to-skin contact during sexual intercourse can also pass on the HPV virus. So if you have a partner and you would want to use a barrier method, we would advise that you do that. And practicing safe sex also has to do with the number of sexual partners that you have. It is very important that you limit your number of sexual partners as well. And then you avoid smoking and alcohol as well. Now, can we treat your HPV infection? Which is a common question we get asked a lot. Now, this picture is showing us that somebody with HPV infection can go from a cervix looking like the normal one, can go all around and get to cancer, which is why I said earlier that if we do a pap smear for you and we don't see anything, that is looking like the normal, the quadrant, the picture where the normal is written, it doesn't mean you don't have HPV infection. But the pap smear is looking at cell change, and cell change is what we see in the other quadrants. Now, routinely, we do not treat HPV infection. We treat symptoms that pop up as a result of HPV infection. The most common thing that people with HPV infection would see, most people would see nothing at all. Let me first say that. Most people that have HPV infection do not see any symptom at all. More than 80% of people wouldn't see anything at all. Some people would see what we call genital warts, which is very treatable. It's easily treated in the clinic. It's not a surgical procedure, no. Your doctor can treat it for you in the OPD, like in clinic, you know. But most people don't see any symptom when it comes to HPV infection. Now, when it comes to precancerous lesions, so let's say, for example, Amma comes to get her HPV test, it's positive. We go ahead and we do a pap smear and we see Amma has some precancerous lesions. It's not yet a full-blown cervical cancer, but you know, it started insidiously. We can do a treatment that takes less than 1 minute. What we would do is we're going to use, let me use simple terms. We're going to use something like electricity. So this red loop would have, you know, electricity on it, and would use it to take out that part of the cervix that has a precancerous lesion, and that's it. So it's like, for example, I have a donut, and the donut has maybe sprinkles on it, and just one side of the donut has chocolate on it, and I want the chocolate part. I will just bite the area of the donut that has chocolates. I'll just bite that part off, and then the rest of the donut doesn't have chocolate. So that's exactly what happens with this kind of treatment. In less than a minute, if we see any precancerous lesions on your cervix, we can go in, we can take out that part of your cervix. It doesn't mean you can't have children. You can have children normally. You can do everything normally, provided this treatment doesn't have to take, provided this precancerous lesion, is at only a part of your cervix, which is why we say early detection helps. If your lesions have taken off your whole cervix, this kind of treatment won't help you. We would have to take off the whole cervix. But if we go and it's just a small part of your cervix, so like I explained, I have chocolate on just a small part of my donut, I can just bite that part off, and I've had my chocolate donuts and I'm fine. You guys can have the sprinkles and eat the rest of the donuts. All right, so can cervical cancer be treated? Yes, it can be treated. Treatment ranges from surgery, plus or minus having chemotherapy, radiotherapy, things like that. But it all depends on how far advanced the cancer is. So like we say, early detection. If it be detected early, we have more options open to us as medical professionals. We have a wide variety. But cervical cancer spreads easily. From the cervix, we're getting it going into your lungs, into your bones, into your brain. It's spreading so widely. And when it starts to spread like that, it's very difficult for us to say we're going to do surgery, because what exactly are we going to cut out? There's nothing to cut out, because that cancer has just spread through your blood. It's just gone everywhere else. And now everything is happening at the same time. You can't breathe properly. You're having so much bone pain. Your tummy, your stomach is so huge. Some people are having things like early dementia because cervical cancer is spreading to their brain and all of that. So the earlier we detect cervical cancer, the better for us. So like I said, this is how treatment modalities. Surgery usually ranges from us taking off your cervix or having to take off your entire womb, depending on how far the cancer has spread in your body. So when we talk about our 10,000 Women campaign, after I've mentioned everything about cervical cancer and HPV infection, our major aim with this campaign is to educate. Like I said earlier, when it's October, we all wear pink October. We're all, excited to get our breasts checked out and all of that. That's great. But we need to get to the stage where we're doing the same thing for cervical cancer. I'm sure most of us don't know that January is Cervical Cancer Awareness Month. We don't, because we haven't reached that level of, in quotes, publicity for cervical cancer, the same way we've reached that level for breast cancer, We're also trying to provide free testing for HPV for as many women as we can. And then we want to educate you on treatments for precancerous lesions, as well as provide an opportunity for vaccination for eligible children and women. Like I said earlier, WHO has given the recommendation that vaccinations can start from age 9 for both boys and girls. And usually the earlier you vaccinate, usually the studies have shown that if you're vaccinated before you enter your 30s, it's better for you. There's more protection that way. All right. So how can you participate in this? We have our Evelyn brushes that are on sale. They are packaged in this beautiful bag where nobody can tell what is in your Evelyn brush. And you can see that there's a QR code on the bag that says scan me. Let me just show you this. Okay. Once you scan that QR code on the bag, you're going to come to a page like this that has information about the 10,000 Women. It's explaining the project to you. How do you get involved? So you would join the multi-program. This would allow you to generate a user ID, which you would use. So you would enter your first name, your last name, your date of birth, and your gender. And you would receive a text message that gives you a unique ID number, which you would use for the duration of the project and even after, if you want to benefit from our multi-program. You would have your self-sampling kits. You would also come where it says enter your personal details here. It will bring you to a Google form where you would enter your name, your phone number, and then the ID number that was sent to you via text message, you enter it here. You want to know when your last cervical screening or pap smear was done and where you're currently located. And then you'll be able to watch a video that will tell you about how to take your sample. I'll play that video shortly. But we also have learn more about HPV and cervical cancer. That's our FAQs. You can download this document, you can read it, you can share it with people just to understand what HPV and cervical cancer are about. So I'll just play the video that shows you how to use your Evelyn brush. Can you see my screen, please, Spider?
Hello, Dr. Osachman, I can see your screen.
All right, sure. Good. So I'm going to just play that right now.
Wash your hands before usage. Remove the Evelyn brush from the packaging. Do not throw the packaging away, as it is necessary for sending the Evelyn brush to the laboratory after usage. Press the sides of the pink cap with your thumb and index finger to remove the pink cap from the Evelyn brush. Ensure that you do not touch the white fibres of the Evelyn brush with your hands. Obtain the sample whilst in a standing position. Assume a comfortable stance, for example, as if you were about to insert a tampon. Spread your labia with one hand, and with the other, insert the Evelyn brush into your vagina until the wings touch your labia. Hold the transparent casing with one hand, and with your other hand, push the pink plunger in the direction of the transparent casing. You will hear and feel a click when the brush is in the right position with the pink plunger directly against the casing. Turn the pink plunger 5 rotations in the same direction. After each rotation, you will hear a click. This helps you count the rotations. After turning the plunger 5 times, carefully remove the Evelyn brush. Hold the transparent casing with one hand, and with your other hand, pull on the pink plunger until the white brush disappears into the casing. When doing so, do not touch the top part of the Evelyn brush above the wings. Hold the transparent end to ensure the white brush does not extend again. Place the pink cap back on the Evelyn brush using your thumb and index finger. You will hear a click when it is properly in place. Put the Evelyn brush back inside the packaging. Place the packaging containing the Evelyn brush into the plastic bag provided and seal it.
Okay. So this video is also available when you scan the QR code. Sorry, just a second. Okay. When you scan this code that is here, it brings you to this page, and you can, using this video as a guide, take your sample. So once your sample is taken, you can put it back in this bag that we brought it to you in, and then you send it back to us. So the HPV test is what we would run on the samples that have been provided. And we would advise that before 24 to 48 hours before you take your sample, you shouldn't be on your period, you shouldn't have inserted any medication or anything else into your vagina before you take your sample. So those are 2 things you need to take. If you're on any medication that involves you inserting into your vagina, it's better you wait until you're done with that medication. Or if you're currently on your period, you can wait when your period is over and then you take the sample, because we wouldn't want the blood to obscure the results that we would have. Once we receive your sample, we would run the HPV test itself. We would run that for free, and then we would have your results given back to you. So I've come to the end. I can take any questions. Thank you.
Wow, thank you very much, Dr. Yawusu. Ladies, please, we'll open the floor for questions. If you have any questions, you can unmute your microphone and then ask, so that you see clarity based on all the insights and information that we've received from Dr. Yawusu. You can ask your questions, please. So you can raise your hand, and then please, Doctor, could you kindly help me stop sharing your screen so that we can know those who would like to ask a question? Yes, please. Thank you. Please, do we have any questions? Let me say that thanks to M-Pharma, HR partnered with them, and we have the sample and the brushes, the Evelyn brushes with us. So we will distribute it for staff or ladies to also get tested. Please, when you receive it, make sure you get the process done, so that we will be able to take them to the laboratory and then share the results. So if you have any questions, since you would participate in the whole process of the testing, we would kindly, okay. Chelsea, do you have a question? It was Mankesa. Okay, so like I was saying, please, we'll be sharing the brushes for us to take the samples, and we'll take them to M-Pharma for the test to be done. So if you have any question based on what Dr. Yawusu shared with us, please feel free to ask your questions, so you see clarity and further details from what she has shared. Okay. Please, any question? Yeah, Mrs. T.
Okay, so please, may I ask a question? All right. I wanted to ask, is it a painful process? Because from what I saw in the video, seriously, I was not so encouraged. The way you have to stand and then you have to insert and you keep clicking and clicking, it's quite cumbersome. So I wanted to know, 1, is it a painful process? 2, the video, it didn't help me. It's too technical. I don't know. There was just too many things happening. So if you can teach our HR how to do it, then maybe when we come to her, then I'll have another practical, encounter with them. Then fine. But
All right, thank you for
the video.
Please,
Hello? So yes, so if I go, you're asking if it's painful. No. So the clicks,
Yes.
you're not feeling the clicks, you're hearing the click. So what it is that when you're inserting it, you're not feeling it because it's a brush. It's like, I don't even know how soft I can describe it. It's extremely soft, like tissue. That's how soft it is. So what the video was trying to let you understand is that when you receive the test kits, it has wings. It just wants you to let the wings touch your labia. That's the external covering of your female reproductive organ. And then when you push the brush in, the clicks were letting you know that one, the brush is in place. And because you're going to turn the brush 5 times, the click was included so that you can easily count the number of rotations you've done. So what it does is that you're just turning it so that we get a good sample. 5, so that we can know that we've gone around 5 times, you've gotten a good sample from your cervix. You're not going to feel it touching your cervix, no. It's not painful, it's not even uncomfortable. It's just a matter of you lift one leg, you put it in place, you push it, you click it. I can teach your HR if you want. I can definitely tell you that it was simple enough for us to replicate this project in Zulezu, where we taught females that hadn't been to school before, and they were able to do it. So I just want to assure you that it's not uncomfortable, it's not painful, and it's not that cumbersome. Maybe because this is your first time having a look at the video, but I can definitely tell you once you get a hang of it, you would attest to the fact that it's very simple.
Okay, thank you very much. And the second question is, you said we shouldn't be in our period. We shouldn't insert anything else in there. So where anything else is, what, like our husband's organs, or what do you mean? So it means like 2 days before the time, everyone should abstain?
No, I mentioned medication. So there are some medications that come in pessary form that have been given to you by a medical professional to insert to treat something. So
Okay.
Up to 2 days before then, you shouldn't be inserting those things. So if you're on such a medication, finish the medication before. So it's 2 things. It's your period and then those approved medications you have to insert. Yeah.
Okay.
Yes,
thank you.
You're welcome.
Dr. Abis, my question is, some people may experience or do experience in between periods clotting. They have clotting in their periods. So will that be something to raise an eyebrow for this cancer?
All right, thanks, Vida. Thank you for bringing that up. So, like I was saying, you shouldn't be bleeding after your period. Yes, we know that there are people that they say, oh, I have 2 periods in a month. It is generally not normal. Even if we put cervical cancer to the side, it is generally not normal. It means that there's an issue. Generally, when somebody presents to the hospital with that complaint, our first thought is you likely have a hormonal issue. And then your doctor would run certain tests and do certain scans to be sure. Is it a hormonal issue? Do you have fibroids or endometriosis or any other illness that is making you bleed this way? Cervical cancer would definitely be at the back of our minds, which is why if you have that kind of bleeding, you should report, because there's so many things that could cause you to bleed outside of your period, or even have those clots that you may see outside of your period.
Okay. And please, I'd like to know how different is this from fibroid? The symptoms for fibroid, how different is this from that?
Thanks. Okay. So when somebody has a fibroid, major things they may see is they may bleed heavily. it's not all the time that they will bleed outside of their periods, but during their periods as well, they tend to bleed heavily, They tend to see huge clots, bigger than, what's our biggest coin now? I think 2 cedi, larger than a 2 cedi coin. That's a huge clot if your clot is bigger than a 2 cedi coin. I don't know if any of you have had bleeding with clots. When you go to the hospital, we usually like to use the coins to estimate the size. Anything bigger than 50 pesos 2 cedi coin is too big a clot. And usually people that have fibroids may have extremely painful periods, especially if they are pregnant. Oh no, let me not put pregnancy here. They may have extremely painful periods if they have a fibroid. And then also they may notice that their abdomen is becoming a bit distended. I mentioned pregnancy because usually people that are pregnant and have fibroids tend to have pain during the pregnancy. That's why I mentioned pregnancy. So that's basically the difference. Fibroids usually give you painful periods, heavy bleeding, and your abdomen may be a bit distended.
Okay, thank you for the clarity. Please, the floor is still open if we have any other questions. So, yes, please. Is it your jet?
Yeah.
Okay, kindly go ahead.
So for the test, can somebody do it for you, or do you have to do it yourself? Because as Mrs. T said, I don't know, it kind of looked some way, even though she has clarified, but I wanted to know if someone can do it for you. Maybe you wouldn't know how to do it yourself. So is it possible that somebody does it for you?
Someone like who?
I like another person.
I'm not sure how comfortable you'll be. So
like obviously somebody that you're comfortable with. Yes, okay. That's what I'm saying.
Let me just indicate here that the Evelyn brush came about, was started producing in the US because of the way females shied away from getting pap smears done, because you go to the hospital, they'll tell you, oh, change into this gown, and then suddenly like two people are looking down. It was a bit uncomfortable. That was why this was developed, so that you do it in the privacy of your home. I think it's because it's your first time hearing it, so it sounds a bit, you may feel uncomfortable doing it. I understand. If you're comfortable with somebody doing it for you, so long as the person is following the steps, not touching the brush, and it's well inserted and the clicks are fine, I don't have any problem with it. Helena, speaking as a resident epidemiologist, do you have any issue with that?
Hello, hi everybody, good afternoon. So usually I think some of the outreaches that we had, a particular one was in North Tongo. Some of the women wanted nurses to do it for them. So the other person where they made the request for the nurses to take to help or assist them take the samples. But like Dr. Yas said, it's not like, it's not uncomfortable at all. Actually, the women actually enjoyed using it. So it's, I mean, when you see, you think it's actually very easy to use and it's very comfortable, and it has that. Otherwise, if, as I said, you don't want, you need some assistance to take it, maybe a nurse can assist in that regard, or somebody that you're close to, and that would be fine.
All right, thank you.
Doctor, please, I'd like to find out, can the use of sharing washrooms cause this virus, or can somebody pick it up from sharing a washroom with another person?
Sorry, could you mind saying that again? I didn't hear a bit of it.
So, like using a public washroom, is it possible you can pick the virus from there?
There have been no reported cases of people picking it up, because it has to do with sexual contact, and it has to do with sexual fluids and things like that. We haven't seen any cases of people picking it up from those kind of places. Helena, any addition?
Yes, strictly. Most of the most of it has been when it comes to sexual contact, and that includes oral as well. So that these are ways in which it can easily be transmitted.
Okay. Thank you very much.
I have a
please.
final question.
Yeah, Judge.
Okay, so that means if you're above 21,
or maybe you're 30 and you haven't had any sexual intercourse, you don't need to do this. Like, it's not necessary for you to test or want to get tested.
All right, thank you for asking this question. So usually when people say you've not had any sexual intercourse, I want to understand what so there's been no kissing, there's nothing at all. So that's the thing. There are so many types of yes. So we get this question a lot. And I also tell people that sexual contact is not just what's, I don't want to say this and offend anybody, what the world terms to be normal in quotes. I'm not saying any other form is abnormal. So sexual contact goes beyond what you or I may term as the kind of sexual contact we are engaging in. I don't know if you get what I'm saying. Yes. So Helena, please, you want to add on?
I think I would agree with what you said, and actually said, because this can be transmitted orally as well. So any other opportunities that allows for this to be spread is possible. Another thing that is also recommended, and that is recent, that at least girls between 15 to 26, before the onset of sexual activity, that is outside of everything else we consider a mode of transmission, can also get vaccinated. And yeah, so that's the option that you may have. But as I said, you may want to think about what kind of engagements have you involved yourself in.
Okay. Please, if there isn't any other question, we would like to bring the meeting to a close. If there are, you can send to HR, we'll share it with the team at M-Pharma and then get clarity for you. Or better still, we'll get Dr. Usuachiman's contact for you so you can speak to her directly, as well as Madam Helena. So on behalf of the team at GMA, we want to say a big thank you to Dr. Yao Usuachiman and Madam Helena for this talk. It's been very insightful. Thank you so much for taking time. We know you're very busy with this project, but you took time to explain to us and then also take us through the process. For the team at GMA, please, we made mention earlier that we have the brushes available. So please, you can walk to HR and pick one. You write your name on the pack that you'll be given so that we'll be able to differentiate this from the other person. So kindly come to HR, just at a salam down, you see the names for one, and we will give a time frame because we want to collect everything and send to M-Pharma at once. We will give a deadline, which we would humbly request that we put all of them together, or we will humbly request that we adhere to the deadline so that we can collate everything and send to M-Pharma for the test to be done. Please, the result will be given to everyone individually. It wouldn't be done on mass basis as we are doing the test. The test and the sample collection will be put together at the HR office. When you do it, you seal it and then you bring it to us at the HR office. We'll send them to M-Pharma. So please, let's not feel shy, or let's not we shouldn't feel deterred from participating in this exercise because it is for our health. And we've gone through the partnership with M-Pharma to get this done for free. So let's utilize the opportunity and then participate in the exercise. It's for our own good. So on behalf of that, once again, I want to say thank you all for joining. The participation has been encouraging. Thank you, our ladies at GME, for participating, and to the team at M-Pharma. Thank you once again. We wish everyone a good afternoon and enjoy the day. Thank you.